guys, I hope you're having a great afternoon. Today I'm going to be reading slides 1 through 36 for chapter 21. This is just half of our slides. I'm going to put these up for you guys for Thursday, and I'm going to leave them open all through the weekend so that you can listen to them. And then I plan on Sunday afternoon doing the rest of the slides so that when we have Zoom class on Monday, we can spend that time actually coding together. So it is a little lengthy, so I just ask you to bear with me. I'm going to go as slow as possible, but you guys know that because they're on a recording, you can pause and highlight your book or get out your CPTs, whatever you need to do to get to know this section better. Okay, so reproductive system. 55920 reports placement of catheters, needles into the pelvic organs, genitalia, for subsequent interstitial radioelement application. We're going to talk about intersex surgery, 55970 through 55980. There are only 2 codes within this subsection: male to female, female to male, complicated procedures completed over extended period of time, and performed by multiple physicians with extensive specialized training. Excuse me. Oh, sorry. Okay. The female genitalia system subsection is divided according to anatomical site. Sites are further subdivided according to the type of procedure. In addition, codes for intro-fertilization are appended in this section. Although this subsection includes a wide variety of codes for minor procedure, codes for these minor procedures are often bundled into the major procedures. Female genital system subheadings are vulva, perineum and introitus, vagina, cervix uteri, corpus uteri, oviduct ovary, and in vitro fertilization. Vulva, perineum, and introitus. That word makes me smile when I say it. I don't know why. Skene's glands coded with the urinary system, incision or excision codes. This is a group of small mucus glands lower end of the urethra, the periurethral duct. Please forgive my tongue tightness. Categories are incision, destruction, excision, repair, and endoscopy. Codes within the vulva, perineum, and introitus subheadings are divided by type of procedure and anatomical region. So IND of abscess, vulva, perineal area are Bartholin's gland, Marsupialization, cyst incised, drained, edges, suture to sides to keep the cyst open. That's going to be found in 56405 through 56442. Destruction. The destruction category contains codes for the destruction of lesions of the vulva, perineum, and introitus. Destruction can be accomplished through chirosurgery, electrosurgery, or chemical destruction methods. So what is the difference between destruction and excision? Okay, destruction is obliteration or eradication of a lesion. Excision is removal of a lesion. Sounds to me like destruction is much more intense. Destruction 56501 and 56515. Simple and complex procedures are coded separately. Assessment of complexity is based on the physician's judgment as documented in the medical record. Divided by simple or extensive destruction. Again, it's based on what the physician tells you in the medical record. Extensive would imply greater physician work, degree of difficulty, or number of lesions destroyed. And it's going to again be stated in the record. 56501, 56515 have a global period of 10 days on the Medicare fee schedule. If the patient returns in 2 days for a recheck, it is included in the payment for the original procedure. Destruction, no pathology report. Because they're not sending anything in, they're destroying it all. Excision 56605 through 56704. 2 biopsy codes are included in CPT 56605 to code biopsy of the first lesion, and 56606 to code biopsy of the second and subsequent lesions. The number of units lesions biopsied should be indicated in box 24G of your CMS 1500 form. You're always going to code based on the number of lesions. Codes 56605 and 56606 are designated separate procedures. If another service code from female genitalia subsection performed at the same session, separate procedure. Codes will not be billed separately. 56606 is an add-on code and describes each separate additional lesion biopsy from the vulva perineum. Code cannot stand alone and must be billed with a 56605. So you cannot bill your 56606 by itself. It is an add-on code and has a plus sign in front of it, which it makes you understand, okay, we can't just code this one, we have to have another code with it. A vulvectomy is a surgical removal of a portion of the vulva, 56620 through 56640. And it's based on extent and size of the area removed. Okay, extent is simple skin and superficial subcutaneous tissue, radical skin and deep subcutaneous tissues. Separate codes are provided for each pairing of extent and size. Note that usual closure is bundled into the procedure, but if plastic repair with the use of a skin graft is required, it must be coded separately. I'm going to ask you a question. Where are extent and size of the procedure documented? In the operative report. It's always going to be in your operative report. If there's not enough information, please query the physician. Code 56640 is unilateral procedure and has no code to describe bilateral. So you're going to need your modifier 50 for that code if it's bilateral. Excuse me. Procedure codes in the repair category 56800 through 56810 include plastic repair of the introitus, clitoroplasty, and perineoplasty. You need to read the notes following the category. If repair procedure for wound of genital, you need to use the integumentary system. Endoscopy 56820 and 56821 by means of colposcopy with or without a biopsy. And we know how to pair up, we know how to code. We know that we need to look for with or without on a continuous basis. So a lot of coding is definitely repetitive. It's the same system, it's the same process over and over and over again, but with different systems and different body areas and things like that. Vagina 57000 through 57426, codes divided based on service, for example, incision or excision. Too often, Confused procedures are coded within this subheading. Colpotomy 57000 through 57010, cutting into the vagina to gain access to the pelvic cavity. Colposcentesis, an excision of the vagina to gain access to the peritoneal cul-de-sac, the area between the uterus and the rectum, to explore it or drain the abscess. If a colposcentesis, it's hard to say, sorry, is part of a more major procedure, it is not coded separately. It's actually bundled into your major procedure. The introduction category of the vagina subheading includes codes for three main types of procedures: vaginal irrigation, insertion of a support device, diaphragm or cervical cap to prevent pregnancy. These codes include not only the insertion of the devices, but also removal of them. Packing of the vagina for vaginal hemorrhage. How are the codes in this category organized? According to the type of procedure performed. Oh, I do want to make a point of report device inserted separately, and then you're going to report your medication codes and your HCPCS codes along with that. And coverage for supplies will vary based on your payer. Code 57180 has a 10-day global period. The repair category of the vagina subheading includes an extensive list of procedures, all of which are non-obstetrical in nature. For non-obstetric repairs, obstetric repairs use maternity care and delivery codes. Global period is usually 90 days, and review the operative report for specific details relevant to accurate code assignment. Okay, manipulation, 57400 through 57415. Procedures coded in the manipulation category involve dilation, which is stretching, pelvic examination, and removal of foreign material. All procedures are performed with the patient under general anesthesia. If the general anesthesia is not required, these codes are not used. Instead, the procedure is coded from the Evaluation and Management Service section of the CPT. Endoscopy. Okay, endoscopic procedures for the vagina subheading are identified as colposcopic procedures in the CPT. These procedures are often bundled into more major procedures, in which case they are not coded separately. When they are the only procedures performed are not unrelated to the procedures performed, they are coded here. Let me read that again. I kind of slipped up a little bit. When they are the only procedures performed or are unrelated to other procedures performed, they are coded here. Colposcopy enables physicians to view an endocervical polyp. Cervix uteri. Codes for endoscopic excision, repair, and manipulation are included under this subheading. Cervix uteri, narrow, lower end of uterus. Services include endoscopy, excision, manipulation, and repair. That's 57452 through 57800. Now we're going to talk a little bit about the LEAP and the LETS. When I say LEAP, I always think of the LEAP test. Okay, the LEAP/LETS cervical loop diathermy procedure is a relatively new office procedure. As shown in this figure, it involves use of electrosurgical loop attached to an electric generator. The generator heats the wire, which is then drawn across the affected area of the cervix in order to remove a slice of tissue for examination by the pathologist. It is used to cauterize the site at the end of the procedure. It is often used as a follow-up to an abnormal pap smear or abnormal examination. So what is the purpose of the LEAP procedure? The LEAP procedure is used to obtain a tissue sample for pathological analysis. It is a less invasive and cheaper alternative to a biopsy. Excision codes in the cervix uteri are used when these procedures are performed as separate procedures and are not bundled into a major procedure. For example, an excision for biopsy is often incidental to a more major surgical procedure, such as a hysterectomy, in which case the biopsy is not coded separately. So conization codes, removal of cone of tissue from the cervix. LEAP technology can be used for conizations. Excision codes in the cervix uteri describe technique and approach used, as well as a component procedures included in the same code description. Corpus uteri, 58100 through 58579. Corpus uteri, located above the isthmus and below the opening for the fallopian tubes. The subheading contains categories for procedures that involve excision, introduction, repair, laparoscopy, hysteroscopy procedures. So let's see. There are many complex procedures here, often very similar wording in these code descriptions. So we need to be very, very carefully reading our scenarios in our medical reports. So I'm not sure how many of you guys have heard of a DNC, dilation and curtilage, 58120 of the uterus. Okay, DNC in this subheading is for non-obstetrical patients only. If performed in conjunction with maternity care and delivery, a code from that section would be used. Many third-party payers will not reimburse for this procedure if it is performed with any other pelvic surgery, as it is considered to be part of the other procedure. Again, another bundled code. It is not listed as a separate procedure code in the CPT. Is a DNC ever coded separately? Yes, when it is the only procedure used or when the third-party payer guidelines permit separate coding. Okay, we do not report a postpartum hemorrhage service with a 58120, which is your DNC. You're going to use a 59160 maternity and delivery code. Oh, sorry, went too far. There we go. Hysterectomy codes represent most of the codes in this heading, 58100 through 58294. Hysterectomy always involves removal of the uterus, but there are many different variations. Hysterectomy codes are first divided on approach, which may be abdominal or vaginal, and then by extent, whether additional structures were removed or procedures performed. Excision. Secondary procedures are often performed by means of hysterectomy. These may include biopsy, removal of fallopian tubes or ovaries, etc. Do not code secondary related minor procedures separately. Remember, if you're having a major procedure and you're already in that area, you can't code it separately. Codes found in the introduction category include the following: codes for insertion and removal of an IUD, codes for artificial insemination. How is the IUD itself coded? Well, I'm going to tell you. The IUD is coded with use of 99070 from the medicine section, the standard code for non-included materials and supplies used by the physician during a procedure. So common procedures here are your IUD, report supply of device separately, specialized service, for example, artificial insemination procedures, used to report physician component of the service. Okay, hysteroscopy. Hysteroscopy is what I'm trying to read up. And hysterosonography are two procedures coded here that rely on radiologic support. Hysterosalpingography. Saline or contrast material is introduced through the cervix, uterus, and fallopian tubes so that these can be examined by the physician for any blockage or abnormalities. Hysterosonography uses ultrasound to complete the same procedures. These procedures are subject to component coding. What does this mean? Technical component coded from the radiology section, or professional component coded here by the physician performing the procedure. Laparoscopy, hysteroscopy. 58541 through 58579. Artificial insemination, including the preparation of sperm for use in the procedure, is coded here. Sperm is injected into the cervix, and a cervical cap may then be inserted to hold the sperm in place. So, laparoscopic approach for removal of myomas or uterus, codes divided by tissue and weight. Laparoscopy, hysteroscopy, continue. Laparoscopy is used increasingly to complete procedures that previously required open surgical intervention. In all, 2 to 3 small incisions are made in the abdomen. Lights, cameras, and instruments are then passed through these openings. I wanted to say lights, camera, action, but that's not what it says. So laparoscopy through the abdomen. See, they made some incisions here where they're going in. Laparoscopy, hysteroscopy, 58541 through 58579. Hysteroscopy through the uterus, surgical laparoscopy with the vaginal hysterectomy, 58550. With this procedure, scopes are placed through the abdomen and through the vagina to provide visualization during a vaginal hysterectomy. Codes in this category are divided on the basis of other procedures that may have been performed along with hysteroscopy. There are codes for supracervical hysterectomies performed by surgical laparoscopy, which are further divided by weight of the uterus and whether the removal of tubes and ovaries was performed. Hysteroscopy through uterus, surgical laparoscopy with vaginal hysterectomy, 58550. Oviduct, ovary, subsection, 58600 through 58770. Oviduct, ovary subsection, procedures performed on the ovaries and fallopian tubes, including incision, laparoscopy, excision, and repair. Circumstances affect coding. Use separate codes for unilateral and bilateral procedures and to reflect timing of the procedure. Watch separate procedure codes. If another related procedure is being performed at the same session, separate procedures are not billed separately. Codes from the laparoscopy category used for procedures in the OVIDUCT ovary subheading are always surgical procedures that include a diagnostic component. If the procedure begins as a diagnostic exploration and ends without definitive action, you use codes from the digestive system because the location of the procedure will determine coding, and the location will be the abdomen. If the laparoscopy results in performance of a procedure on the ovaries or fallopian tubes, it will be coded in terms of the procedure performed. For example, lysis of adhesions, orphorectomy, and lesion excision. Okay, based on purpose of the procedure, lysis or lesion removal, caution, if only diagnostic laparoscopy, do not use female genitalia system. You're going to go to the digestive system, 49320. Two categories of codes in the ovary subheading: incision for the draining of cysts, excision to report ovarian biopsy, cystomectomy, and orphorectomy. How are these procedures divided? Incision codes are divided on the basis of approach. Excision codes are based on the type of procedure. In vitro fertilization, this is going to be our last slide for today. Specialized codes provide for in vitro fertilization, a procedure in which eggs are fertilized outside the body and prepared for implantation at a later time. Note that the third-party payers often deny claims for fertility services. So how are codes in the in vitro fertilization section divided? By type of procedure and methods used. So we're stopping here. I hope that wasn't too much. I tried to give you half now, and then I'll give you half for Monday. I hope you guys have a blessed Easter. Enjoy the sunshine, take a walk, smile, and stay positive, guys. I'm so proud of you. You're doing such a great job. Bye-bye. We'll see each other on Monday.